So the question is, what's the challenge? Why is the MEQ exam a more challenging exam? The challenge is that when we train as registrars, training and the systems that we work in forces us into short-term silo thinking. We see patients for a few months, and therefore the foreseeability, the thinking that's required for it, is limited. We've not needed to think 3-4 years down the track. We've not needed to think about what their family systems look like. What's the path of least resistance in front of us? We learn to hand over to the next team. So metabolic management or EPSE management becomes disconnected from the choices, pharmacological choices that we consider in the acute setting. We learn to do the risk assessment, complete the forms, prescribe the medication, arrange follow-up, and move on. The patients left our mind. So what's important to recognize is that it's not the registrar's fault. We know that systems create that way of thinking. But by understanding the fundamentals, we may shape practice for our patients in the future. And we may also shape how systems can improve patients and carers' lives. So what's the MEQ asking you to do? It's asking you to think across time, across systems, to foresee consequences. It also asks you to hold multiple issues together, for example, clinical, ethical, legal, and relational issues together. It's asking you to think about how to manage conflict across these multiple domains. That's the consultant level thinking. It also asks you to prioritize. So what am I trying to convey here? I'm asking all of us to stop seeing the MEQ as a rote learning exercise or a memory exam. It's really a thinking exam. And we know there are two systems when it comes to thinking. System one, the rapid, reflexive, heuristic-based thinking, and the system two, the system that applies falsification of hypotheses. We're integrating both. And if we can shift the way we think in the first 2 to 3 minutes after reading a question, the quality of the answer changes. And I'll come to this 2 to 3 minutes later in this lecture. The way we use these 2 to 3 minutes is what makes the difference between scoring and getting lots of marks on domains versus whether we're just simply writing more and not addressing the actual question. The 2 to 3 minutes is about seeing more, not just writing more.